Ed here. Welcome to another edition of Voices of Innovation, the author series, and we go international, we go global. So Juan Luis, welcome to Voices of Innovation, the author series.
Thank you, Ed. Thank you for inviting me.
Yeah, so it's so great to have you. You're both in the first edition, and the story is so compelling and so great, which we're going to get into. It's also in the second edition, and I know that you're a great innovator, so we'll have you share a little bit about yourself. But two things before we get going. One is I have to pitch the book. So this is the reason that we're chatting today, is Voices of Innovation. Second edition comes out July 17th, 2023. And you can pre-order now. We'll drop a discount code in the comment section, and you can get it, signed copies as well. And, you know, we did it for a number of reasons. One of the reasons was to share best practices across the world, which is the coolest thing, because we're all trying to do the same thing, right, in healthcare, and that's save people's lives, improve the quality of care, patient safety, which we're going to hear about here in a second from Juan Luis. And so it's great to get all these stories of people actually doing it around the world, and then you can leverage the lessons learned. And then it's great for the hospitals and the individuals involved as well. But perhaps the most important thing is all the profits from the authors go to, in this case, Mary Crowley Cancer Research is a stage 1 clinical trials center based in Dallas-Fort Worth. I serve on the board, and the introduction is written by the CEO. And so it's just really good place where people who are suffering from cancer don't have much hope. That's where hope lives. So it's very cool. But Juan Luis, before we get into that, what's your favorite football team, by the way?
I'm from Madrid, so Real Madrid is the one.
I know. I was thinking about that when I went to Madrid. One of the things I had to do was go to the stadium, and just get a picture. And I think by the time I got there, it was closed, so I couldn't get a tour or anything. But someday when I get back to Spain, which, as you know, I get there quite a bit, I definitely need to see a couple of football matches.
Okay, great.
So share a little bit about with us about yourself and about your organization.
Well, I'm currently I'm the CIO of one of the biggest hospitals in Spain. That is Hospital 12 de Octubre. But when I did the project that is in the book, I was the CIO of Puerta de Hierro Hospital. That is a smaller hospital, but quite advanced. It's a medium-sized hospital, around 600 beds. I'm an engineer and telecommunications engineer by training, but quite early I decided that I wanted to work in the healthcare sector. A strong sense of mission, here in the healthcare sector, to make patients' lives better, and to help professionals, and you say sometimes also to save lives. We are not working on IT, we are saving lives somehow. So that's why I decided to work in the healthcare sector. And at that time, it was when the experience that we wrote in the book was started around 2012, something like that. So 10 years ago, but I think it's still valid. Yeah.
Tell us a little bit about, so what I liked about it had to do with safety, and how you had this experience, and then really innovated around safety, making it a safer practice.
The project started when the Dr. José Luis Bueno, that is currently still the head of the blood bank in the hospital, came to my office and say, hey, we have to do something, because yesterday almost we killed a patient. He told me the problem around the errors in blood transfusion, in the blood transfusion process. Well, that's the thing that ignited the whole project. It's a humble project, it's something in a medium-sized hospital in Spain. But I think it's great to have a place in the book, because the project touches many of the things that are key for successful innovation, and innovation with impact. That is what, at the end, is what we want. It's not just innovating for the sake of doing something fancy or new. It's for impacting patients.
Yeah, that's what I loved about it. And that's why we included it in both editions, because it really speaks to the heart of what we do, what we spoke about, in saving lives, improving quality care, and patient safety. And things happen, and we all know bad things happen in hospitals. And we can really leverage technology and innovation to really improve outcomes. And that's certainly what you all did. If I just ask you point blank, what's one reason someone should go out and buy the book? What would you say? Anything else you want to share about your particular example?
Yeah, sure. In I think our chapter, for example, I think it touches some key elements of innovation. For example, the project identified very well specific strategic objectives for the hospital. The first one, avoiding errors, patient safety, you mentioned. But also other, for example, saving blood components or reducing workload for professionals, getting accurate data, and of course, saving money at the end. Also, is in the project. So it started with a very good definition of what we wanted to achieve, and also working on the process, on the work process. It wasn't around just putting IT to solve something, but to redefine the work process and then bring the best IT around to support that transformation, that new process. Also involved a lot of people in the hospital. So I think that was key also, to involve people in the solution definition, and then after that in the implementation of the project. Around 200 or 300 people at the peak of the project was working in the project, trying to, nurses teaching other nurses how to work with the system, and that was great. And I think it was part of the success. And something that also many times we forget, that is evaluating what we did, because it's key to know at the end of the day if what we do are allowing us to get to those strategic objectives that we define at the beginning of the project. And all these ingredients are in the project. Why to read the book? Well, I think it's full of this kind of experience, actual experience. It's not an academic book of theory around innovation. It's full of actual experiences that you can read and maybe get inspired in your hospital or your health system to apply some of the things that went well, and also identify some of the errors that are also mentioned in the chapters. So I think it's a great book for people like us that are working in this field.
Yeah, no, that's a great pitch right there. I need to reuse that. But yeah, Juan Luis, you bring up a great point. It is super practical, and you were already kind of sharing some of the highlights from your chapter about all the practical steps. So, yeah, and you're right. Not only is it not theory, it's real stories, but most of them are written in a way that you could follow that. Oh, I want to do what he did or she did, and these are the steps to accomplish it. And it gives you this framework. And I love what you said about the evaluation at the end, because a lot of times we just move on to the next fire. We move on to the basis, and then we never learn. I was always dumbfounded. I was an Army combat engineer officer, and I would take over a company command or something, and our platoon, and we were always doing the same mistakes every year. We never took the time to learn. So it always cracked me up in a way. But anyways, thank you so much for your contribution.
Thank you. Thank you, Ed, for your work. Yeah. Your tremendous work to launch this second edition of the book. I think it's going to help many people around the world, and also for fighting cancer. That is, you mentioned, is a good cause. So thank you to you, Ed.
Well, yeah, you're welcome. And it's a great, as you know, collaboration of wonderful people like yourself. And that was a cool thing too, right? We get to meet each other, and we get to learn from each other, and iron sharpens iron. And you're a great man. And even though you're Real Madrid, and
looking forward to your visit to Madrid.
Yeah, we'll definitely be back. So thanks again. And again, we'll drop how to order the book in the notes in the comment section. So thank you so much.
Thank you. Bye.